This year marked the 13th anniversary of Midshore Behavioral Health's Across the Lifespan Conference. Each year, this conference has allowed Midshore Behavioral Health to highlight topics that are relevant to the behavioral health field and be supportive of our ever-changing and evolving best practices to enrich the community and individuals across the lifespan. This is one of our signature events at Midshore Behavioral Health. This year's theme was Building a Trauma-Informed Community. This theme is a very timely theme for the work at Midshore Behavioral Health as an organization. Last summer, we decided to embark on a journey as a team to strive to become a trauma-informed organization. And since then, that's been a priority and focus of a lot of the work that we're doing as a team and as an organization and how we serve our community. As a part of this process, we had a wonderful opportunity to solicit some regional provider engagement from our network here in the Midshore region to join in this process. We've been extended the opportunity to do this work through an opportunity called the Healing Systems Learning Collaborative. The Building Healing Systems Learning Collaborative is a partnership between the Maryland Behavioral Health Administration, the University of Maryland School of Medicine, Bowie State University, and other local authority partners in the state. Together, we are working to look at Maryland's public behavioral health system to align with best practices to be a trauma-informed state and make sure that we are healing-centered with our care, our approach to behavioral health services, and our cultures as organizations serving Maryland's communities. We've been working closely over the last several months with some special partners in the Midshore to comprise our cohort on this journey. I want to give some acknowledgement to Affiliated Sante Group, For All Seasons, and Talbot Family Network, who are a part of our Midshore cohort on the learning and trauma-informed exploration process that we are currently working on. The hope of this work is to not only enhance our organizations as trauma-informed organizations with our culture, but to be able to work and connect with additional partners and providers in our Midshore community to continue to do the work together and bring trauma-informed practices to our community members receiving services. Through this work, the team really was inspired to bring the theme of trauma-informed communities into the Across the Lifespan space. This is a wonderful opportunity as over the years we've had many different themes that we've been working on as a team and that are relevant to the current behavioral health climate that we feel are important to bring into the Across the Lifespan space to extend opportunities for connection, partner engagement, and education on a specific topic. Over the years, we've had the opportunity to do many different themes. Most recently, we looked at embracing the whole person, connecting mind and body, and how integrated health is so important in practice today. We've looked at dismantling stigma and finding hope in healing and recovery. We've had a theme of hope rising right in the heart of COVID, where we realized that mindfulness was such an important practice to get us through and have strength and continue to be able to support the work that we do as providers. We've looked specifically at our veterans population. We've done a deeper dive into the adverse childhood experiences work, also related to trauma. We've looked at the strength of how peer support can be really an opportunity for a new layer of resource and behavioral health professionals that we need to integrate into the work that we're doing. We've looked at substance use. We've also done a little bit more specific work around substance use with how we looked at the impact of the opioid epidemic and how the Across the Lifespan conference allowed us to look at new interventions for help and support. We've looked at crisis services and crisis response across the lifespan. And one of my favorite topics that we've looked at over the years is resilience across the lifespan and how that is something that we are always nurturing. So this year's theme of building a trauma-informed community in many ways brought several of those themes that we've visited historically together for a wonderful conference. And I'm just so grateful for the opportunity to continue to extend this learning and partnership space for our Midshore community.
Scales I do in my very first assessment is the Columbia Suicide Severity Rating Scale. Okay, we need to be able to ask the hard questions. We'll talk a little bit more about that too.
So why should we address trauma, and why should we have trauma-informed communities? Well, first of all, we can't have any trauma-informed communities without having trauma-informed individuals and organizations. So remembering respect, information, connection, and hope. Things such as the ATL conference that we recently hosted in St. Michael's help to achieve those things. Increasing awareness across the lifespan, looking at early on with the prenatal 0 to 5 population, looking at looking at attachment and bonding and the importance of that. Also, in looking at epigenetics, unresolved, unhealed trauma, how that is passed on through our DNA to the unborn baby. So by having trainings, we're able to provide information which increases our awareness. There are 6 key core principles when we talk about what a trauma-informed approach looks like, and that's safety, trustworthiness and transparency, peer support, collaboration and mutuality, empowerment, voice and choice, and looking at, lastly, cultural, historical, and gender issues. The keys to creating a trauma-informed approach to care are creating those safe environments. You can't have anything without a safe environment and trust. Having trainings such as the ATL for our workforce, and this includes non-clinical staff as well as clinical staff. Recognition of secondary trauma, burnout, and vicarious trauma on our direct line workers, behavioral health community providers, law enforcement, first responders, military, and then communicating about the transformation process. So we also need to take care of ourselves by being aware of the importance of having debriefings after a crisis, and periodically for our staff wellness, general staff wellness. So the after effects of trauma tend to show up in many different ways through somatic complaints, going to primary care physician's office or pediatrician's office for complaints such as gastrointestinal disorders, headaches, backaches, those sorts of things. Being trauma-informed, you're then able to ask the questions. Is there something different happening in your life or going on in the home? And with our pediatricians and looking at our school systems, we're able to look at the clinicians and providers looking at the differential diagnoses. So little Johnny might seem like he's hyperactive. Is that possible attention deficit hyperactivity disorder, or he's oppositional defiant disorder, or some of our more extreme conduct disorders and things? Or is there just severe chronic stress happening within the household? So our schools, our teachers, everyone in the school systems being aware and trained in trauma-informed approaches helps with our communities. Crisis workers, looking at VA clinics. The justice system oftentimes sees the after effects of unresolved trauma. Our direct care referrals that behavioral health providers get in substance use, peer support, harm reduction, having all of those things infused with the behavioral health community can certainly help. So the recent ATL conference highlighted how looking at the person through the stages of life using a trauma-informed lens can mitigate or lessen those negative effects of trauma and the abreactions or re-traumatization. We want to prevent that. By increasing individual awareness, we then build stronger trauma-informed organizations and communities. Society does tend to be a more reactive versus preventive. So we want to get ahead of that versus responding to those after effects. So finally, us being able to share information at trainings such as the ATL, that breeds hope by promoting awareness, social support, and having the networking amongst the different behavioral health organizations, school systems, our veterans population, our assisted living and nursing home communities, which therefore creates hope and resilience, and ultimately proactive trauma-informed communities.